Good to see you.
Good morning, everybody. There he is.
Thanks, Ron.
Thank you. Roger, let me start by asking you, you're an engineer by training, not a physician, not an epidemiologist. What motivated you and the company to get involved in this issue?
Well, you have to understand the company a little bit. So we're a 49-year-old company, and for 42 or 49 years, we were employee-owned. And so we've always had a very active employee population and very vocal. And as CEO, I like to say I've got 32,000 bosses. And they're more than willing to send me an email and to point out issues of the day. And that happens all the time. And oh gosh, 6 months or so ago, I got a longer than normal email from an employee who works in one of our DOE programs out of Pittsburgh. We have about 330 locations in the US. And I started reading it, and it just really reached out and grabbed my heart. This fellow's name is John Hinman, and he had a son who was an athlete in high school who'd gotten involved with over-the-counter drugs with opioids, and as John relates the story, had been in rehab, been out. And eventually, having been off of opioids for a while, had a relapse, and because his tolerance for opioids had gone down, he took a lethal dose, and there was no naloxone or Narcan available, and so he lost his son. And we do about 25% of our business in healthcare. We have worked with CDC, population health, with NIH. And so we have a big presence in the whole healthcare market writ large. And it was sort of a call to action. He said, listen, I'm doing all I can, awareness in the Pittsburgh area. What can the company do, and what can you do? And it just reached out, and I said, I wasn't all that aware of the pervasiveness of this as an epidemic.
Yeah, so you began your initiative this spring.
Right.
What have you learned over that period about where an employer, where a company can be most useful in helping its employees deal with this?
Right, well, it was a bit of, an engineer sort of breaking down, what's going on, and, supply, demand, and all that. And we kind of put it in three pieces, awareness, prevention, and treatment, and found that from a corporation, frankly, as an individual, we can actually touch all three phases. Awareness, we work with DEA 360 program, public service ads, education at the K through 12 level. On prevention, we actually fund disposable bags. You can go to our website. We make those available to our employees and anyone who wants to go to our website and ask for one. And actually, we have a mail order prescription program as part of our medical benefit. We've talked to our provider about cutting down the dosages and making the drug less available. And then in prevention for us, it was to make sure that families of who have a problem in the family have access to what is really the antidote, naloxone or Narcan. And so we have funded dosages of Narcan, the nasal aspect, to anyone who will come and take the training. And we use Chris Atwood Foundation, but there are other organizations that we're involved with. We're able to move quickly. We're able to amass the resources to try to deal with this at those three levels.
You mentioned 330 locations around the country. Does this problem look significantly different in different places? Are you finding that it is unfolding in different ways?
It's really socioeconomically blind. And in fact, what we have found is it still has a stigma. I grew up in the 70s, and the idea of morphine-based, recreational, that stigma still exists, and way too often it's not identified or it's not dealt with proactively. And what we find in all of our locations, in all socioeconomic classes of our employees, it is a problem. And it's a problem because I don't think it's identified, and I don't think it's dealt with in a proactive way. But we do find, really from coast to coast, that this
really
is a
everywhere.
Problem.
And based on your experience and what you have seen in the reaction from the employees, where and the kind of the learning what the levers are where you can make a difference, What would be the principal lessons of your experience you would say to other large employers?
Well, first of all, it is a problem, and it exists in your population whether you know about it or not. And unfortunately, it is, again, because of the stigma, it's not brought forth as much as some of the other issues that we have been dealing with in the medical. Like we do a lot of cancer research. Everybody, cancer is, okay, this is an epidemic and it has a stigma, sort of like, well, you got into it because of recreation. The fact is most people who have this problem got to it through a prescription, right? Because of a sports injury or surgery or something like that. But what we found is it exists, within your population, within the community in which you operate, and there's a lot that you can do about it. There's awareness and funding, and what we like within Leidos as a company, we can move dollars quickly. And by the way, we've found both at the federal, the state, and local level great partners in government. This is an issue you saw from the prior panel that touches home for all of our elected officials. And when we have wanted to go out to a community center or put a program in place, we always get strong support from the elected officials in that community.
So, and maybe you've hinted at the answer already in something you said about kind of the reach of this, but what do you think is, at this point, the biggest misconceptions about the way this crisis is unfolding?
I think the misconception is that the people who have an issue or have an addiction to, especially something like oxycodone or fentanyl, that this was somewhat self-inflicted and brought upon themselves, or maybe they got to it because, from a recreational standpoint, and it's not that at all. I mean, these are people who never intended to get addicted. They might have had a pain problem, they might have had a lower back, it could have been a sports injury, it could have been, in my case, I had a rotator cuff surgery this year. I might still have, oxycodone in my medicine cabinet, and the stigma is, so let's not talk about it, let's not bring it forward, let's not go get help. We have an employee assistance program at Leidos. From an anonymous basis, our employees can go get help. And the stigma is go treat it, go deal with it, get it out in the open. And I'm really pleased in the last 6 months, last year, there's been a lot more discussion, a lot more awareness. There are parents out there who probably don't even know what the signs look like because we haven't been talking about this for very long. And because it starts often under a doctor's care, having to deal with a medical condition, it's thought of, well, if I have a prescription for these medicines, then maybe it's okay. And the answer is, abuse of anything, whether it's prescription or not prescription, is not okay.
What do you think the hurdle is that is preventing more employers from under? I mean, why are we not seeing more large employers make this kind of?
I think it's more awareness. Everyone that I talk to, other CEOs here in the National Capital Region, they're not aware the depth and breadth of what is truly an epidemic. 2 weeks ago, I had a town hall where we talk about our financial results and our strategy, and I always take questions at my town hall, and 2 questions in, someone in the back stood up and said, I had a son who died of opioid addiction. Frankly, kind of getting ready for this event, I was going through emails last night, and I learned of a close friend who had a son pass away just recently from an opioid addiction. And I think the issue with other CEOs and other corporations is they don't know. Yeah. Because of PII issues and because we keep all medical data confidential within the employee.
PII?
Personal information, personal medical information, the HIPAA laws and things like that, it's hard to aggregate the numbers. But we know in 2016, we had more people in the U.S. die of opioid addiction, opioid overdose, than the number of soldiers that we lost in Vietnam, Desert Storm, Desert Shield, and Enduring Freedom combined in just 1 year. And I'm sure you've seen the statistics in Maryland, which is where I live, we lose more people to opioid addiction in the state of Maryland than car crashes and gunshots combined.
Let me ask you one last thing. We just had 3 senators talking about public policy. Obviously, our hosts have had a very explosive expose over the weekend on public policy. Without getting into necessarily those specifics, what do you think the private sector needs in terms of public policy and partnership with governments in order to make the maximum impact?
Well, first of all, I would tell you that we have enjoyed great partnerships with government agencies, again, at the federal, state, and local. We need a good container and a set of policies that allow us to garner resources so we can address the problem. We need awareness. And to some extent, we need to focus on the issue and maybe not look in the rearview mirror. We are where we are, and it's about what we're going to do from today forward relative to legislation and dealing with this. I mean, I saw the 60 Minutes piece, and I understand that, the facts that were laid out there, it's sort of like, I'm not sure I care. I care about what we're going to do tomorrow to address this terrific epidemic here in the U.S.
Thank you. First of all, you've given us a lot to think about. And second, it would not be a panel in Washington if you had not given us an acronym that I did not know. So that I think that now we officially have conducted a Washington panel. Thank you.
Ron,
and I'm going to turn you back to the Washington Post for the remainder of the program. Thank you.